Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic medicine, of course, Kai Chikitsa, and Ayurvedic physiology, that is MD in Kriya Sharira subject. For paid online consultation, you can definitely WhatsApp me on 9226810 So now, many patients, they ask me, sir, you are talking about, as you are a physician, of course, you are liable to talk on any topics of the medicine, starting from the general, what you can say, the medicine, up to the some specialization like the ophthalmic problem, for example, then surgical problems, this and that, skin problems, dermatological problems. Yes, then are you doing the consultation for all these problems like ENT? You are also ENT surgeon. You are like no, 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 my dear friends. I'm not saying like that. This is a content or this is a knowledge generated from my team of the doctors, and I am representing as a director of the team of the Ayurveda Academy. And so I have a lot of doctors specialized in a different faculty. I have the Ayurvedic ophthalmologists, Ayurvedic surgeons, Ayurvedic ENT specialists, Ayurvedic pharmacologists. So many specialties are with me, and naturally I am doing the whole these things with all my respected friends and the colleagues and the doctors. They are helping me for online consultations as well as for space. But of course, there is a control, there is a coordination, there is a guidance of Professor Dr. Deshpande is existing. So nothing to be worried about. Those who wants to take the treatment of gynecology, for example, I have the female doctors. Yes, they will take your case taking, not the gents doctor. They will, females are there. Then I have the Ayurvedic pediatricians. So they will take care of the children. So nothing to be worried about. You just WhatsApp on 9226810 and you will get the best Ayurvedic management by proper case taking. Many people say, sir, why I am taking very nominal charges for the consultation, online consultation. We have the offline also. I'm in Pune. So I have the nearby many centers of these doctors, and you can be invited to. But I request that first you should go for the online consultation for 1 month, and then we get the little bit idea. Anyway, now I have already mentioned that I have the expert Ayurvedic eye specialist doctor. Those who want to take, for example, vision problem is there. Sir, I want to remove my specs. I want to prevent the cataract. Then definitely you can WhatsApp me. I will talk with or coordinate with these expert doctors of ophthalmology or the eye problems, and we will give you the best possible treatments. Okay, let us start to discuss main eye problems in general medical practice. I am not talking about the hospital management. Remember this thing. First is a blepharitis. You know what is blepharitis? It is a edema. ITIS means inflammation or the edema of the eyelid. I think you know, everybody knows this. This is my eyelid, upper part covering. This is a protection eyelid. And when there is an infection, that is called as a blepharitis. Whenever there is infection, will be pain, there will be swelling, there will be edema, and the local temperature will be raised, this and that. Then sty, everybody knows that it is a Ranjanavadi in Marathi. That means there is a small pustular eruption at any part of your eye, especially lower side of the eye, you get this particular sty. Then chalazion is a hard nodule-like structure which is coming into your eye. Black eye, without with some trauma or the accidents, the person get the black or discoloration around the eyes, that is called as a black eye. Red eyes are there. Chronic and acute dacryocystitis, very important. Here is our lacrimal gland. As you know that everybody is having the tears, and they come whenever there is allergy, whenever there are fumes, whenever there is irritation. And normally also the tear protect our conjunctiva, palpebral conjunctiva and sclera and all these parts, because there is a lubrication. So sometimes this gland is situated here or here, right or left, both sides, and there is inflammation of this dacrimal or lacrimal gland, that is called as a dacryocystitis. Again, pain will be there, tenderness will be there, swelling will be there, lacrimation will be there, everything will be there. Okay, conjunctivitis, your eyes become red. It may be bacterial, it may be allergic, whatever it may be, inflammation. Xerosis is a deficiency of vitamin A, that is a dryness of the eyes. Subconjunctival hemorrhage, again because of the trauma or something. Glaucoma is a little bit serious condition. You have to just diagnose, give the basic treatment, but basically glaucoma and cataract should be sent by the general practitioner, by our people, to the specialized MS in Ayurvedic ophthalmology. We have the MS, yes, post-graduation, and we refer in Pune. My best friend, Dr. Rajesh Pawar, is there, and he has an excellent team of the doctors, and we treat together this particular ophthalmic problems. Even you can come to us for surgical interruption. We do the fantastic surgeries even without much of the complications or much of the invasive techniques. Now there are the lesser treatments are also available. Okay, phaco, something like a for cataract purpose. Now let us see the etiology, investigation if required, and the treatment. Blepharitis is the inflammation of the eyelid. It is a protective organ. Poor hygienic condition. Eye is a very delicate. Eye is a very delicate. Vitamin A is necessary. Proper proteins are necessary. Ghee, cow's ghee is essential for the eye protection because it is a Majja Dhatu Pradhan Avayo according to Ayurveda. Majja Dhatu Pradhan. And here is also basically Pitta dosha is existing, which is called as Alochaka Pitta. And it gets problem whenever there is a lot of bacteria, viruses, fungi, or the allergy is there, then stagnation is there and inflammation takes place. Occurs at all ages, but it is more common in the children. Usually follows an exanthema, like for example, measles and chickenpox, exposure to the smoke. Now the air pollution is worst in India, in many cities, big cities, cosmopolitan cities like Delhi, Bombay, Pune, Bangalore. Everywhere there is air pollution, and that is the main enemy for our eye. So be protected. Hot sun is very bad for the eye. Remember, eating very spicy foods, very bad for the eyes. Remember this thing. But in spite of that, aloe vera eye packs, very good, fantastic. Then the rose water, fantastic for the eyes. Refractive errors, vision problem, you cannot see because in the children there is a habit. They are shy and they don't want to wear the specs, and they hide that I cannot read on the board. So whenever there is a headache, whenever there is something eye problem, please visit to the ophthalmologist, check the vision, whether it is a myopia or hypermetropia. He cannot see for the longer distance, or the old people cannot see the near objects like that. Then seborrhea of the skin of the lids and scalp, dandruff here on the scalp. That also has a connection with the eye. Remember, very interesting. So you should not have the dandruff on the hair, scalp hair. Then use of the cosmetic. A lot of now people are so much here, eyebrows, and then these so many cosmetics that you are using, and if you are not careful about those cosmetics, your eyes will be permanently damaged. Latest, you have seen that in the Ganpati festival and all these things, many governmental organizations, doctors, they mentioned that because of the lasers, especially with the lot of sound, your ears have gone, and with the laser, many people, they lose their eyesight because of that laser directly going to the or affecting to the eyes in the Ganpati festival, Mirunuka, or the processions. So be careful from the damaging objects that is harming to your eyes. Even the Ranga Panchami, festival of the colors, they throw the colors, synthetic colors, and by chance it goes into the eye, and that can permanently damage your eye. Be careful. Sensory organ is there. Use of the cosmetics on the lid margin, be careful. Occasionally parasites cause the blepharitis or the theriasis palpebrum, and what to do? Here is the Ayurvedic treatment that you can try. Sukshma Triphala is like always I am mentioning, it's like Ayurvedic antibiotic, broad spectrum antibiotic. I have the twins of antibiotic tablets like Sukshma Triphala and Gandhaka Rasayana in Ayurveda. So my dear friends, you can use very easily that 2 antibiotics according to Ayurveda, and yes, it will definitely give you the good results if it is a mild or moderate type of infection. If it is too severe, then better Ayurvedic ophthalmologist is there, and they can prescribe some standard treatments. Laghu Malini Vasanta, 2 tablets 3 times in a day, local application, externally, not internally, not touching to the mucosa. Lepa Goli is also available. Regimen, that is Pathyapathya, general health and hygiene is important. If dandruff, please scalp, treat it accordingly. Consult a specialist to rule out any ophthalmic causes like vision problem. Avoid the beauty products, especially the eye applications. Avoid the dust, avoid the smoke, avoid the wind, and avoid the sun. That means too strong winds or too strong sun. I am saying that I am not saying you stay at home all the time. It is not possible. Next is a sty, hordeolum externum. My dear friend, this video, as it is giving you the exhaustive knowledge of the eye problems, please bear with me and see the video till the end, because video may be little bit longer, because that is giving you the valuable information. Okay, so occurs at all the ages, very common in the adult, frequently associated with constipation. Oh my God. Uncorrected errors of refraction, myopia or hypermetropia. So go to the ophthalmologist, check the vision and correct it if you have the glasses. Even the refractive errors, glass number is always changing, especially at some age. So be careful, change that number and use the glasses as and when required. If constipation, always take care of the constipation. Treatment, Arogyavardhini, 2 tablets 3 times in a day. Sukshma Triphala, 2 tablets 3 times in a day. Triphala Guggalu is anti-inflammatory, 2 tablets 3 times in a day. And Laghumalini Vasanta, giving the strength to all the dhatus, especially Maunsa dhatu. So Maunsa Agni is kept very properly and it gives the strength to overall your body. 2 tablets 3 times in a day. Then regimen, that is a Pathya for the sty. Local application externally. Don't touch to the mucous membrane. Lepagoli Ayurveda Shala Pune, Maharashtra state. Fermentation, very easy. Ferment with a towel soaked in the warm water. Local application of garlic juice, but be careful. This is not for common man. I will not recommend that this type of the measure should be taken by the common man. No. It is a duty of the Ayurvedic ophthalmologist. Okay, if recurrence, check for the ophthalmic pathology like vision or any systemic causes like diabetes mellitus. One of the important, whenever there is a sty, always check your blood sugar. Next is a chalazion, which is also called as a tarsal cyst or meibomian cyst. The difference is, look here, look, sty is always over here, near the lid margin. But chalazion, I am closing this, is little bit away from this margin. So it is on the upper part. Can you see here? Can you see here? Chalazion. So there is a difference in the sty and chalazion. Sty is very nominal or casual. You can treat it very easily, but chalazion sometimes require the surgical intervention. Okay. Chalazion are often multiple and occurs in crops, more common in adults than in children, often associated with refractive errors. My dear friends, treatment near about same for any disease of the ophthalmic problem with inflammation. Arogyavardhini, it is Amapachak, liver stimulant, liver tonic, corrects all the metabolic process in the body. Ojo Vardhana, and immunity will be best. 2 tablets 3 times in a day. Sukshma Triphala, broad spectrum Ayurvedic antibiotic, 2 tablets 3 times in a day. Kanchanar Guggulu for Lekhana Karma, scrapping, 2 tablets 3 times in a day. Laghumalini Vasanta for general boosting your strength, 2 tablets 3 times in a day. My dear friends, let us move further. Local application. This is about, again, we are talking about chalazion. Okay. Lepagoli externally, always externally. Fermentation with towel. This is the easiest way. Everybody can do this very easily. In case of chalazion, is a big incise and no improvement with the treatment. Evacuation of the content by the incision, by the Ayurvedic surgeon is necessary. Okay. Now we will talk about black eye, ecchymosis. Okay. It is mainly because of the trauma or the accidents. Sukshma Triphala, broad spectrum Ayurvedic antibiotic, 2 tablets 3 times in a day. Mostly discoloration, black color of the eyelid, takes more than a week to get better. So be patient. Patience means keep patience. Don't, so doctor, again on the second day it is the same doctor, no improvement. Coming in the evening again, doctor, no improvement. My dear friends, it will take some time, minimum 1 week to resolve your problem. Okay, mostly local application. So here you inform the patient about this. I have already informed. Local application of ice packs if immediate trauma. Local application with towel soaked in warm water if after 1 day. So first 24 hours, eye packs. After 24 hours, hot fomentation. This is very important. Local application of Lepagoli externally, Ayurveda Shala from Pune. Now, this is the next disease, which is dacryocystitis. That is inflammation of the, yes, lacrimal gland, either right or left, generally unilateral. Okay, it is related with the tear, ashru in Marathi. Lacrimal abscess, not only improves the sac, but the surrounding tissue as well. It is damaging to the surrounding part. The microorganisms from the sac pass through the small defects in the mucous membrane and reach the pericystic tissue, exciting suppurative inflammation. Whenever there is a pus will be there. Okay, so what to do in Ayurveda? So there is a specific treatment. Again, a type of antibiotic for upper respiratory tract. Himalaya company has a tablet, Septiline. You can try definitely. Rhinitis, tonsillitis, bronchitis. Yes, yes. 2 tablets 3 times in a day. Gandhaka rasayana, sulfur, broad spectrum antibiotic of Ayurveda, but be careful. Sulfur has some people, some patients, they may have the allergy of sulfur, so they will, especially pitta dominant prakriti, should be very carefully taken these medicines, Gandhaka rasayana. 1 tablet 3 times in a day. Punarnava is an anti-inflammatory, diuretic, and new regeneration of the cells is possible because Punarnava, Borrelia diffusa, Punarnavadi glue, 2 tablets 3 times in a day. Local application, Narikelak Jambu, AVS, Aryavedya Shala, Kottakal, South India, 1 drop in each eye 2 times in a day. But again, not by the layman, it's a duty of Ayurvedic ophthalmologist. Local application externally, Lepagoli, not by common man, please. Ayurved Rasashala Pune. Again, another prescription for dacryocystitis. Can you see here? Arogyavardhini Amapachak, liver tonic, 2 tablets 3 times in a day. Kaishoro Gugulu, Kaishoro, Guduchi, Giloy, Tinospora cordifolia, best blood purifier, best antiseptic in Ayurveda, immunomodulator. Kaishor Gugulu, 2 tablets 3 times in a day. Ayurvedic broad spectrum antibiotic, Gandhak rasayana, 2 tablets 3 times in a day. Chronic dacryocystitis, it is a chronic inflammation of the lacrimal sac, usually resulting from an obstruction to the nasolacrimal duct. There is a connection of that duct, eye and nose. It is connected. So there will be blockage over there. Investigations, what you can do? Predisposing factors. We must understand what is the basic cause behind the disease. Hereditary factor may be present in some cases. Commonly affects the elderly person with dirty occupation, lot of air pollution, unhygienic conditions. Women are more commonly affected, presumably due to the narrower lumen of the nasolacrimal duct in females. So that duct is narrow comparative to the male. So male and female comparison. This is anatomical nature's gift, so we cannot escape from that. Disease may occur in the newborn due to the imperfect canalization of the lower end of nasolacrimal duct. Now, we are talking about, yes, you remember dacryocystitis. So these are the exciting factors. Effects of obstruction of the nasolacrimal duct arising from the chronic inflammatory condition in the nose. Like for example, chronic sinusitis, chronic rhinitis. The lower end of the nasolacrimal duct may be obstructed by nasal polyp, hypertrophied inferior concha, or DNS, deviated nasal septum. Bacteriological examination of the fluid from the sac usually shows the presence of large number of staphylococci, streptococci, more commonly pneumococci, and very rarely syphilis, sexually transmitted disease, venereal disease. You can do the VDRL test, blood test. Tuberculosis may be the causative factors. Now let us see the treatment. Try out the syringing of sac for few days by the Ayurvedic ophthalmologist available with Ayurveda Academy. Refer to the specialist. Of course, Ayurveda Academy may need the dacryocystectomy. We do, our team does the best eye surgeries. So please do come to Pune to get these facilities done. Next, we will go further. It's a conjunctivitis disease. First, we will see the different types of the conjunctivitis. This is the most common eye problem. Most common eye problem. Okay. So inflammation of the conjunctiva, that is a lining on the sclera or the eyelids. Acute catarrhal or mucopurulent conjunctivitis. Lot of discharge is there. Stickiness in the morning is there. You don't know, a burning, then pricking sensation in the eyes. Photophobia, you cannot see on the light. Not the sun, not the tube light, not any light. Photophobia. Phobia is a fear. Okay. Acute purulent conjunctivitis, it is something special. Gonococcal, again, like a syphilis, gonorrhea is a disease because of the visiting to the prostitutes or sexual workers, like, for example, venereal diseases, STDs, syphilis, gonorrhea, AIDS, HIV. So you can do the VDRL test. And especially here, you get the urethral pus discharge from the penis. So be careful. And that also has an infection to the conjunctivitis in adults. Then ophthalmia neonatum, the newborn child, acute membranous conjunctivitis. So my dear friends, let us talk about Ayurvedic medicines or the treatment. Pravala Bhasma. Why? Why? Because inflammation is Pitta. Pitta is Ushna and Tikshna. Any Pak is inflammation and Pak is related with the Pitta dosha problem. So anti-Pitta treatment, Pravala Bhasma, 250 milligram, 3 times in a day. Sukshma Triphala, Ayurvedic broad spectrum antibiotic, 2 tablets 3 times in a day. Chandra Kalaras, Pitta Gna, anti-Pitta, 2 tablets 3 times in a day. Local application, Frutico eye drops, eye wash with water prepared with boric powder, or Netra Sudha. Again, eye drops, Ayurved Seva Sangha Nashik, Maharashtra State, India, 2 drops 2 times in a day for eye application. Or castor oil, 1 drop in each. But again, whenever there is an instillation of eye drops, nasal drops, ear drops, my dear friends, don't do by yourself without the guidance by expert doctor. I request all of you. Okay. Then Elanar Kujambu, Ayurveda Aryavedya Shala Kottakal, 2 drops in each eye. Now the Pathya, as disease is a contagious, conjunctivitis go from one person to another. So one family member is affected, all family members will be affected if the care is not taken. So be careful. Even with the friends, even with the schools, even with the offices, be careful whenever there is a conjunctivitis. That's why they wear the black, the specs or the goggles. Regimen, as disease is contagious, enough care should be taken to use of goggle as advisable. Handkerchief, towels should be sterilized and should be used only by one patient. Now, next problem regarding the eye is a xerosis. Let us see what to do. Degenerative condition characterized by lusterless condition of the conjunctiva, dry, total dry, not due not to diminution of the lacrimal secretion, but to change in the tissue themselves. Refer to the specialist because this is complicated disease. Symptomatic treatment, Triphala Churna 1 teaspoon plus honey half teaspoon, ghee 1 teaspoon. Always remember, honey and ghee should not be taken in the same amount. Remember this. Both are Yogavahi, catalyst. They improve the action of the medicines. Chavanprash 2 teaspoon 2 times in a day with milk. Next problem is a subconjunctival hemorrhage. Okay. Its the main cause is again like black eye, trauma or the accident, mechanical rupture of the vehicle during a sudden and violent congestion in the head, like violent muscular strain, fits of coughing like that, vomiting, compression of the first neck veins, petechial hemorrhage in acute conjunctivitis, especially in the pneumococcal, diseases of the blood like purpura, hemophilia, scurvy. You can do the bleeding time, clotting time. This is called as a blood dyscrasias. In Ayurveda, it is called as a Rakta Pitta Vyadhi. Okay, it may occur spontaneously during menstruation. It may occur in young healthy individuals without any apparent cause. We are talking about subconjunctival hemorrhage. This is a Pitta problem and Rakta Dushti is there. Okay, Rakta Pitta Vyadhi. Local application of IPAX in the early stage. Assure the patient as most of the time 3 weeks time problem can be resolved. It's a very slow process. Kama Dudha. This is a tablet of anti-pitta, 2 tablets 3 times in a day. Avipattikara Churna, best laxative. Because whenever a pitta problem, Ayurveda recommends laxative. Remember this thing. 1 teaspoon with warm water at bedtime and Saptamrita Loha, specific medicine for eye and ear, 2 tablets 3 times in a day. Glaucoma, as I have already mentioned, this is a serious problem, better way tackled by the ear pressure is extra. Severe pain in this one eye or both eye, but tremendous pain inside, tremendous pain, like something eye is coming out. Such a headache, such a pain on the eye, and there will be blurring of the vision, blurring. then when you go to the, if a general practitioner has been trained to measure the intraocular pressure, he can find by the tonometer. After anesthetizing the eye, you can measure the blood, this eye pressure, and if it is high, immediately refer to the, because there may be retinal damage. There may be retinal damage, there may be blindness if it is not properly treated very quickly. Okay, cataract, it means development of the opacities in the lens, congenital or developmental cataract. It forms either at or soon after the birth. It may occur due to some serious illness of the mother in early months of the pregnancy, like German measles. It may be because of vitamin deficiency. Next is a mostly common is a senile cataract. Senile means during the old age. Senile, old age. Traumatic cataract is also common, secondary to certain diseases of eye like iridocyclitis or glaucoma. Just now we have discussed intraocular pressure is increased, associated with certain general diseases like diabetes mellitus, tetany, then cretinism, myotonia atrophica, diabetes. Please check your blood sugar. Due to certain medicines, like for example, experimental cataract, that is dinitrophenol, naphthalene, lactose, and galactose. Cataract due to certain poisons like ergot poisoning, epilepsy, and eclampsia in the pregnancy, that is also called as a toxemia of pregnancy. Irradiation cataract due to exposure to the X-rays, radium or gamma rays, infrared rays, and deficiency cataract like vitamin B12, vitamin C, B2, vitamin C, and tryptophan deficiency. Occupational cataract like in the iron melters cataract. Now treatment, in the immature stage, always check eyes as a number may be changing. Okay, use of magnifying lens. If central opacity, use the dark goggles can help. If peripheral opacity, then patient can see in the daylight. Mature stage, of course, you have to go for surgery, and surgery is the only treatment for the mature cataract. You can prevent the cataract, you can control the speed, but if it is totally matured, better way, remove the cataract, remove that opacity and make the artificial lenses, and you will be get improved. So my dear friends, this is, we are coming at the last part, poor eyesight. This is many times the people ask what to do, sir. We don't want the specs. So that is a Drishti Tail Ayurved Seva Sanganashik, 3 drops in each eye. Triphala Churna 2 to 4 teaspoon with warm milk, or you can take with the honey, Triphala powder also. Saptamrita Laho, 2 tablets 3 times in a day. Special instructions, use of the milk, that is a protein, then eggs, wheat, rice, barley, mung, green gram, leafy vegetables, carrots, pomegranate, triphala are advisable for most of the eye diseases. So my dear friends, this was the discussion, a big discussion on the ophthalmic problem or the eye problem. But be assured that whenever you get any serious surgery or problems in the eye, you definitely believe on Professor Dr. Deshpande. Come to Ayurveda Academy by WhatsApp 9226810630, and we will take good care of your eye problem. Nothing to be worried about. Thank you very much. I request all of you to subscribe my YouTube channel and don't forget to press the bell button icon. Thank you very much for your nice cooperation, love, and affection. See you in the next video. Thank you. Take care.